Good evening, and welcome to my presentation on the management of low back pain. So let's just start off with some statistics around low back pain. Low back pain is the leading cause of disability worldwide and rising. And it's estimated that over 80% of people will experience an episode of back pain at some point in their lifetime. And in 2020, a staggering 690 million people suffered from low back pain. So if you have low back pain tonight, you're definitely not alone. And tonight, as part of my talk, I'd like to bring you through some historical low back pain treatments, what an evidence-based care looks like, and tips on how to manage a flare-up of your back pain. So historical treatments, low back pain is nothing new. And it's been documented that potions and spells have been used by ancient civilizations. And Hippocrates, the father of medicine, a Greek philosopher and physician, even documented exercise and manipulation. So I hear you ask the question, what has changed? And in truth, not much. There's multiple non-surgical treatments out there. And these kind of range from core strengthening exercises, dry needling, manipulation, wearing back braces, taking even painkillers and having a spinal injection. The list is endless. And we can't forget our conflicting advice between colleagues and friends and our good old Google. But in essence, a lot of these treatments are actually quite costly, and when used in isolation, often ineffective. And a really good example I have is I had a young patient come into me last week, and she's been having weekly treatments for the last few months, and her back pain is still there. It's actually getting worse. And she comes in and she tells me that everyone's quite puzzled as into why she still has back pain. So she went on to have an MRI scan. And this is where a picture isn't 1,000 words. So her MRI scan came back completely normal. And we know from the evidence that having some age-related changes in an MRI scan is quite normal. And these changes increase with age. And I typically describe them as, it's like having wrinkles and grey hairs. And it doesn't necessarily correlate to a person's back pain. And another issue with, I suppose, an MRI scan, it's a static picture. It doesn't tell me how you move. It doesn't tell me, about muscle imbalances between your core muscles and your leg muscles. But more importantly, it doesn't tell me about your thoughts and your feelings. So this particular patient came in to me, and because she wasn't getting better, she really felt that something seriously was wrong. She was scared to move her back. And she really felt that she was going to do more damage if she was going to move into her pain. So she was protecting her back, having really good posture and not lifting anything heavy. And I'm going to talk about, these thoughts a tiny bit later on, in my presentation. So if we move on to current day, what does evidence-based care look like? So there's guidelines out there to help guide physicians as into how to manage back pain. And these guidelines recommend that we kind of have a combined care tailored to each person's needs. And this may consist of education around kind of like your back and your do's and your don'ts, exercise prescription, manual therapy, and for some people, psychological therapy. And again, for us as physicians, we want to give you some tools to help manage your back pain. So when we go on, what does recovery look like? So when we adopt kind of an evidence-based care approach, what does recovery look like? Well, most people would love to see the graph on the left-hand side. In essence, back pain, the recovery can be quite complex. And I always describe in the beginning, it's like a squiggle. And this is where, for us as clinicians, having a deep understanding about what's going on is really important. So we want to take a kind of an in-depth history about what's going on in your life, but also about some, fears that you have around your back pain. So many people are quite fearful of moving their back and causing recurrent pain. And I want to know about your expectations. Do you think it's going to get better? Because it's really important that for all of you out there that suffer from back pain, that you have this hope and hope that it will get better. But as I said, kind of listening to your story is so important because it helps us to tailor that exercise program to your needs. And once we kind of get on track, recovery is still going to have its peaks and troughs. And a good example of where I really want to figure out what's going on in your life is I had a patient a few weeks ago who came into me, and he had 3 weeks of really saving kind of low back pain. And he'd seen 3 other physicians prior to coming to see myself. And, throughout the assessment, we were able to change his pain through exercise. And I was like, well, this is great. Brought him back a week later, and he was kind of over 70% better. And I was really curious about, why, what got you better? And he actually said to me that it was a phone call with his boss. And his boss had given him some reassurance, going, don't worry about work, come back whenever you're better, I'll pay you for while you're off. And he came back and he told me it was that kind of reassurance that helped him to kind of, not panic about getting better. And in essence, it was, that social stress that was removed from him that allowed him to progress with his rehab. So after kind of getting like that history from you, what do I want to see? I want to know, are you breathing? How do you bend? How are you standing up from a chair? And what is your posture like? And for me, these 4 key, questions are really important, because unless we get the basics right, it's very hard to make improvements within an exercise program. So let's talk about breath. So many patients come into me and I'm like going, are you breathing? And they're like, oh, no. And I was like going, are you protecting your back? And they're going, yeah. They're all protecting the back because they're so fearful of causing, damage. And it's really important to know that your back is strong. 90%, over 90% of people with back pain, there's no one specific cause for it. And you hear the word I'm saying that most people say it's non-specific or it's benign in nature. But, it's not serious and it's not harmful, while it's really impacting your life and, causing you distress. It's not harmful. And when people come into me and I see that they're bracing and they're protecting, I kind of go to kind of a clenched fist. And I use this analogy and I get my patients to make a clenched fist. And if you can all make a clenched fist now for me, and really, really squeeze your fist as hard as you can. Okay, and now I want you to try to move that fist up and down. And it doesn't feel that nice. And I hear a bit of clicking and cracking, and actually my knuckles are beginning to get a bit sore. And your knuckles and your wrist are actually the same as the joints in your back. So if you're bracing and holding your breath, you're probably increasing the amount of stress and strain going through those joints. And also, if I'm holding my fist all day long, I'm beginning to feel my forearm muscles get a bit sore. And I'm sure you are too there. And now I want you to move it. And now I want you to relax your fingers and just move your wrist up and down. It feels so much nicer. And that's the same with your back. So you need to breathe, you need to relax. And that's really, really key. And this won't probably come natural to you. So it's important that you're telling yourself, okay, breathe, relax. Feel your tummy. Does it feel soft? And the next thing I want to look at is, how do you bend? So your spine is made up of segments stacked upon each other. And within each kind of bony segment, you have a disc. And it's designed to twist and to turn. So by you keeping your back very straight, you're not allowing your back to do its function. And hence it kind of may feel a bit stiff and a bit tight. And these are some videos that I'm just going to show you of how some people typically move when they come in to see me. So the first video is someone kind of hinging forward. You can see here he's keeping his back really straight and he's just hinging from his hips. Another movement pattern that I typically see is that you bend from your legs and your knees and you're trying to keep that back really straight. But what I want to see when you come in to see me is that we're flexing, we're bending through your upper back, your mid back, your lower back, and your hips. And this movement is quite nice. And again, when you're bending, I want to make sure that you're breathing. And, when you're bending, it's okay to feel pain and discomfort. You're not going to do any harm. But if you can, on a daily basis, throughout your tasks, thinking about every time you're bending to pick up your socks or you're doing the laundry, that you're actively going, let's breathe, let's move through my back normally. That will really help in your recovery. So next we go on to posture. Everyone comes into me thinking that you should have this real upright posture. And when we have back pain, I typically see that people probably try to overcorrect their posture. And if you can go back to that clenched fist analogy, if you're holding yourself upright and squeezing your shoulder blades and trying to have kind of, that nice straight posture, in essence, you're kind of going around with that clenched fist all day long. So you kind of have that increased activation of your back muscles. So what I generally like to see is that perhaps you're a bit more slumped, you're relaxed. And when we're kind of rising from sitting, so we'll go on to kind of looking at how people typically come in when they've back pain and how they stand up. Most people come into me and they're keeping their back straight. They're using your hands to come up. And this is kind of like, I kind of say, it's like a co-contraction, so people pushing down through their arms, or kind of, increasing that intra-abdominal pressure within your tummy, and increasing activation of your trunk muscles. And if you can see in this video, Stephen here is going right upright. He's not flexing through his back. He's pushing through his arms, trying to keep his back straight. And when we look at the function of your arms are for reaching and for pulling, not for standing. Your legs are for standing. So it's really important that when you're kind of rising from your chair, that you're using your legs. So this is an example where we get Stephen trying to keep his arms relaxed. And you can see his nose is coming over his knees. He's not using your hands. And he's kind of really sending those hips backwards when he wants to come down. So he's utilizing his legs. And this is a lot nicer on your lower back. And it's actually a lot easier to do. So next time at home, when you're rising from a chair and you have back pain, think about bringing those knees or your nose over your knees. Think about really trying to use those legs instead of pushing through your arms. So next, what I want to look at, once we kind of have those functional movements done, I want to do an in-depth analysis of how your muscles are functioning. And it's been shown that a lot of people who have back pain and even who've recovered from back pain will have this kind of altered muscle activation. And what I typically see is that patients' back muscles and core muscles are actually quite strong, and it's the leg muscles that are weak. And, from a retraining point of view, what I want to do is kind of like try to get those leg muscles and those bum muscles stronger. And I want to be really specific when we're exercising. So the next slide will show kind of some examples of some, specific exercises. And every exercise that we give at this stage can be tailored, to your needs. But what I'm looking for is that when you're exercising it, you're feeling it in that right muscle group. So when I give you kind of a bum strengthening exercise, I want to know that, yes, it's your bum that's working and not maybe, the muscles in the front of your thigh or the muscles in the back of your thigh. And the first exercise here is, you can see Kieran, he's doing what we call a hip thrust. And this can be modified into a lower level by perhaps doing what we call a bridge, or it can be made slightly harder by going into a single leg hip thrust or adding on a weight. And the next one you'll see him, he's doing kind of what we call a kind of sideline hip abduction. And you'll see that this green band, this is called the Terra band, and it's a resistance band. So, he's pulling up against a bit of resistance. And this resistance is really, really important, because what we're looking for is that we're developing some changes in those muscle fibers so that you're getting kind of like those strength changes that you need in order to help with your recovery. And when we're bringing you through an exercise program, it's really important that you're kind of working at a level where those changes will happen. So I generally say an effort level of 7 out of 10 is what we're aiming for. And when we're looking at repetitions, doing, 8 reps or 7 out of 10 should be sufficient to kind of allow you to get the changes that we need. But it is all about being specific within that muscle group. So next we can go on to what we call, strength training. So we're kind of looking at the whole body, and there's guidelines from the World Health Organization, and they say that all adults should be doing at least 2 days of training per week. And in order to see changes kind of in your pain levels and in your function, it has to be a progressive strengthening exercise program. And this can take, 3 to 4 months. So this is where, what I typically see, in clinic is some patients come back to me and they go, doing the exercises, I'm not seeing any changes in my pain levels. But what I'm actually seeing is I'm seeing changes in your strength. And it takes time for some of these strength changes to kind of correlate to a reduction in your pain levels. And this is where not kind of giving up on your exercise program and keeping that hope is still really, really important. And you can see to the right of my screen, I have some cross-sectional pictures of an MRI scan. And what I'm looking at here, I'm looking kind of at your the two kind of black circles at the back of it, and they're called your paraspinal muscles and your multifidus. And the picture to the top left-hand side kind of is normal good muscle fiber. And then as you go down through the other three pictures, you can see there's a lot more white within these back muscles. And that's what we call fatty muscle infiltration. And that gives us an idea that those back muscles just are not working. And that may be contributing to your pain. And a study that was done here in Sanctuary Sports Clinic back in 2015 found that patients who did a kind of a progressive loading free weight exercise program actually had a reduction in their pain and improved quality of life, improved function, and this correlated to kind of an increase in muscle fiber architecture on these MRI scans. So strength training does work, but you just need to give it time. You need to put in the effort and you need to be consistent. So what else kind of is evidence-based care? We need to look at cardiovascular exercise. And the research will tell us there's no right and wrong. And my recommendation for you tonight is to really pick something that you enjoy. And it's about that consistency. So again, the guidelines are recommending that we're doing between 150 to 300 minutes of moderate cardiovascular exercise per week. Now, obviously, you're going to me, I have pain, I'm not able to do that. And that's okay. I suppose my tip is to start small and to gradually build it up. And there is a kind of research to show that actually walking is such a great exercise for people who have back pain. And this was a study that was on kind of the Guardian newspaper, and it was published in the Lancet journal, and it was done in Australia. And they looked at people who had recovered from low back pain, and they put them on a walking program. And what they found were the people who engaged in a consistent walking program actually had a reduction in their flare-up and the severity of that flare-up. So kind of, simple exercise, you can go outside, it doesn't cost you anything. And again, you can just start small. Even walking around the house, if you have a severe amount of back pain, it's building it up and then gradually trying to progress it. So the next, managing a flare-up. Okay, so what do we do? Flare-ups can be very distressing. And again, they can be quite disheartening, especially if you're improving in this journey of managing your back pain. And, once you have an episode of back pain, you have an increased risk of developing another episode of back pain. The first thing I would suggest is don't panic. You haven't done anything serious, okay? And it will get better. And if you've had previous, flare-ups of back pain, you know that it will get better. And again, what we want to kind of like, see is that you're trying to still keep those normal kind of functional movements going. So you're still using your breath work. You're not trying to protect, your back. Trying to do some simple exercises while you're in this flare-up will actually help you recover quicker. So it's all about keeping moving, but pacing yourself. So, if you typically would have gone for half an hour walk, perhaps during a flare-up, you're going for 2 5-minute, walks, paced throughout the day. And on my next slide, we have an example of some exercises. One of my favorite exercises is what I call a child's pose. And this is, again, a really nice, safe exercise. You're kind of getting a nice stretch through those muscles along your back. And again, you're using your breath, and you can hold this stretch, for anywhere between 10 to 30 seconds. Doing simple knee hugs, even just bringing one knee up to your chest at a time. If able, you can bring the 2 knees up. This is Kieran here doing some breathing. And I generally kind of recommend patients during a flare-up that you might go onto YouTube, find a nice, meditation video, and just focus on that belly breath, trying to relax through those back muscles. And then what do we do after a flare-up? We actually want to get back exercising, okay? And again, you may not be able to get back to the load that you were lifting prior to a flare-up, but as soon as you feel able to, you're getting back into the gym, you're getting back down onto your exercise mat. And this is kind of a picture of Stephen doing some of his strength work. So here's kind of a nice goblet squat, getting the muscles in the front of the leg going. You might be able to go into a nice split squat. And all of these exercises, again, really safe for people who have back pain. You're targeting the leg muscles. And the main thing, I suppose, after a flare-up, we're really striving for function. And I suppose that's one thing that I really try to encourage, my patients to do, is to set goals for yourself. Try not to be chasing your pain, but chase your function. So look at, in conclusion, there's no one magic solution. And I suppose everyone's journey of back pain management is quite different. Consistency is key, and it does take time. And flare-ups will happen. But what counts is really how you manage them and you get back on track, and you have that kind of end goal in sight. And if you've got any questions, I'd be really happy to answer them now.
Claire, it was a really interesting talk, and the questions are flying in now, so we'll start. Can Pilates cause flare-ups in pain? A person's currently doing mat Pilates weekly, but finding flare-ups in pain since they started, and they are doing it under physio supervision.
Yeah, Fiona, that's a really, really good question. And I suppose I typically would hear that sometimes people come into me and they're doing exercise and it's causing their back pain. And it's not that the Pilates or the exercise is bad. Sometimes it's down to your technique. So, I typically say that if you're feeling it in your back, it's a sign that you're using your back muscles and not necessarily your core. So a lot of the times it's just down to your technique of how you're doing some of your Pilates exercises. And if you kind of remember my talk, I was talking about a lot of diaphragmatic breathing and using that breath control. And that is really, really important to help relax some of those back muscles. So it might be worthwhile that if you're finding in a class setting that that's flaring up your back pain, that perhaps you're kind of going for a one-to-one session, and that you're kind of really trying to work on, your technique and how you're performing, the exercises, so that you can get a lot more specific with how you're activating your core.
Thanks, Claire. Now that someone else I'm going to bring this one in because it's about yoga as well. They're saying, is there a positive relationship or benefit between lower back pain and hip opening yoga movements?
Yeah, there is. And I suppose, a lot of the times it's about if you're kind of stiff in one segment, you're going to have to gain that movement through moving another segment. So a lot of the times if we see patients in our clinic, if they're really, really stiff in their hips, they generally tend to overuse their backs. So if you can kind of free up your hips and allow them to move a lot more effectively, a lot of the times that can help improve your back pain. And some of that stiffness within the hip can be freed up not only through stretches, but also through strength training as well. So trying to get those kind of like hip muscles working a tiny bit better. So yeah, there definitely kind of is that correlation between the lower back and your hips.
Lovely, thank you. How best would you deal with very stiff lumbar vertebral discs?
Yeah, again, I suppose, what we always do is treat the person in front of us. And again, it's trying to, get that flexibility back into your spine. And there's various ways of how you may do that. And it's kind of really that bespoke exercise program, per person. So you kind of want to know, well, maybe what's driving that stiffness. Is it that there's that kind of like tension in your trunk muscles, and do you need kind of a bit more relaxation techniques? Is it that your back muscles are just not allowing you to move because they're compensating for weak hips and weak legs, and that actually your treatment program needs to be more targeted towards your leg muscles? And then you have, the classic stretching program that some people, can do kind of on a daily basis, to help with that. But a lot of the times you're kind of trying to bring it back to function. How is that stiff back affecting you day to day? And you're kind of trying to maybe drive your exercise program to your function, as opposed to just maybe trying to get a really flexible back.
Yeah. Okay, thank you. Tips for driving if you've sciatica, and also what are the best swimming strokes for neck and lower back pain?
Yeah, so good question. And, it's horrible when you suffer from sciatica. There's nothing worse than nerve pain. So I definitely feel for you. But driving, I suppose, a lot of times with sciatica, your nerve just doesn't like being stretched. And when you are driving, unfortunately, that can put extra stretch on that nerve and cause irritation on it. So best tips that I generally say is, take regular breaks, kind of avoid long journeys. So if you know that you're going to be traveling 2.5 hours, maybe every half an hour or 40 minutes, get out of the car, do a little walk around. Also, maybe try not to have your car seat, bolt upright. So change, the angle of your car seat, and you can kind of vary it back, back and forwards throughout your car journey as well. And they're probably my two main tips of how to limit irritation of that nerve when you're driving. And the second part, maybe, swimming, again, it's, I generally kind of, again, really patient, specific. If you have a lot of pain on that, like backward bending, through your lumbar spine, then, trying to maybe limit, going into your breaststroke or your backstroke can be quite good. And again, you're kind of looking at that whole spine, if your neck is really stiff, you want to avoid the amount of times that you're rotating it from side to side. So sometimes spending as much time in the water with your head in neutral can be better as well.
Okay. Do you find that there's a difference between ages and gender, and when the way people progress if they're doing strength and conditioning physiotherapy?
Yeah, I think, I suppose, improvements can be kind of multifactorial, and we know kind of from the talk that different factors can feed into patients improvements, and one of them is making sure that people are doing it consistently. But regards to ages, I think once you get kind of over the age of 65 and you're getting some changes within those muscle fibers and muscle bulk called sarcopenia, sometimes it can take a bit longer to build up the strength. And that's where probably adding on resistance and weights is even more, important. So sometimes the older you get, the harder it is to build that muscle bulk. With regards to gender, again, that postmenopausal woman, with the hormonal changes, again, that can influence your ability to put on, muscle bulk, as well. So yeah, there can be that changes kind of in the gender as well.
Can physio improve spondylolisthesis? I've probably said that wrong.
Yes, spondylolisthesis. And again, I suppose as a physiotherapist, we're not going to, I suppose, change a specific, structural change within your spine. So what spondylolisthesis is, it's kind of a forward slip of one bone on top of the other. And this can kind of vary to, different degrees. And while it's nice to know kind of a specific diagnosis, we still treat what we see with regards to your movement and your strength deficits. So physiotherapy can, definitely help improve that, because a lot of the times the first line of treatment is non-surgical.
Yeah. And I suppose that leads into, how do you know if you're seeing somebody and you're assessing them, how do you know which is the best route to go?
We kind of use an outcome measure. It's called the Start Back screening tool. And that even helps us guide what's the best form of treatment for you. And we just use it as a guide. Like, again, everyone has their, bespoke treatment program. But some people actually just need advice on how to self-manage. And they can go and do their own exercise program. Another kind of cohort might just kind of need an exercise, program. And then you have that other cohort which need a bit more of an MDT approach, having some, psychological, approach. So, at work, we tend to use that to help guide us, but we're also really listening to you, what's your preference with regards to your exercise and, what type of exercise training do you like? And again, we really try to kind of like fit it into your schedule as well. So while it's recommended that you might be doing strength training 2 to 3 times a week, if you have a really busy life and you can only fit it in once a week, then we'll work around that, or, we'll give you, tips on how to incorporate it a tiny bit more, into your schedule. So there's various tools that we use to really create that bespoke training program just for you.
Is cycling good for lower back pain or should be avoided?
Yeah, no, I love cycling. I think cycling is one, it's like, I suppose there's no one exercise that's better than the other. But I really like cycling. I think it's really, really safe. I think the back is in a nice, relaxed, position. You're getting the legs, working hard, and you're getting a bit of cardiovascular, fitness as well. So I'm a big advocate for cycling.
Yeah. And someone's asked about swimming, as you've mentioned. They've asked about, you find swimming as well. You've already answered that one as well. Can deep tissue massage help?
Yeah, you know what, I suppose, again, when you look at kind of, any of the guidelines, manual therapy is part of kind of an evidence-based care. I suppose the issue is that you just don't rely on it. It can definitely help in acute spasm and acute episode of pain where you do manual, therapy. And I would typically say, while the majority of my treatment sessions are exercise-based, in a certain cohort, they might need 10 to 15% of that treatment session, which is manual, therapy, just to help get them moving, help reduce their pain. So yeah, it's definitely a good option, but not in isolation.
No. Is paresthesia increasing intensity into the foot, radiating into the calf, hamstring? This is about a patient, I think, who's back pain. And pain in general with movement. I think they're just asking, is it a concern if there's increasing paresthesia?
Not necessarily. I suppose when you're listening to that, you're kind of going, okay, is it a nerve irritation? If it's paresthesia alone with a small bit of pain, and I suppose one of the advantages of seeing, a patient kind of face to face is that you're doing a thorough examination. And I suppose, part of that examination is, ruling to see is there any kind of signs of something serious going on, like cauda equina, but also another part is your neurological examination. So if patients have those symptoms, but your neurological examination is completely normal and you're happy that it's definitely coming from the spine, then kind of that watch and wait approach is fine, where you can bring them through kind of a guided exercise program. So not necessarily option for concern, but it's something that you're monitoring, because I suppose what we do know with spines and lumbar spine is that can be an evolving pathology. So what presents to you on a Monday may be completely different in 2 weeks' time, and that's the importance of having that baseline neurological examination.
Okay. Someone here, they said they've back and neck pain for 30 years, MRIs, X-rays, they've osteoarthritis, it's age-related wear and tear. But at this stage of their life, they can't do any bending or lifting as the excruciating pain, and their neck and shoulders are painful. Any suggestions or where they go with that one?
Yeah, and it's hard because sometimes you get into this kind of cycle of pain and stiffness, and more kind of stiffness can cause more pain, and we tend to stop moving because of the pain. But actually, if you can gradually build up, exercise, some of that pain, will reduce. And I suppose you're not going to do more damage by, moving into pain and exercising, into pain. And it sounds like this person has pain in various different areas, and it's going on for quite a long while. So potentially this patient could be good from an MDT approach as well, that it's not just kind of, you know, physio, you're looking kind of at that wider, you know, picture. But it is important that we're kind of getting some movement into the body. And a lot of times patients who are presenting with chronic pain, I tend to try to chase function as opposed to pain. So, you know, you may still have the same pain levels, but can your function, you know, improve? So I would, in that situation, chase function as opposed to pain sometimes.
Okay. Now, somebody here is asking about what's typical time to get an appointment privately. Now, with a consultant, it probably varies on what consultant it is. If it's urgent, you probably will, your GP, if he marks it urgent, or your physio does, if they're very concerned, probably consultant will get an MRI and see you then. For physio, Claire, I'm not sure at the moment, what's the appointment time?
Yeah, look, I would probably say we've no waiting, you know, list. Do you know what I mean?
Yeah.
I suppose we have a large team, so we always kind of will slot you in someplace. So we are, and like we work Monday to Friday. You know, so I would say no, we'll get you in, you know, within, you know, a week to 10 days.
Lovely, thank you. Just someone said they're a physiotherapist. Lovely talk, and the language used was very patient orientated, and I've learned some good tools for communication in my own practice, which is nice to hear. Thanks for joining us tonight, and thanks for everybody that joined in and asked questions. Please fill in the evaluations when they're sent out to you, and keep an eye on the website for any future events. And as I said, you can go back into the portal to look at past events, and this one will be on if you want to direct anybody to it. So thank you again for joining us tonight. Thank you.